shape would be like.
It's funny because for me, I had to shut my eyes to be like,
Yeah.
oh wait, yes,
And these
this
are
is
both
more firm,
silicone.
right?
These
And
are
this
both
is-
silicone.
And this is the same size then, right?
You know what? This is 325 and this is 371. So this is
Okay.
a little bigger.
Okay.
Yeah.
It's really interesting.
Yeah.
Huh. Have these always been around, the textured ones?
So there's been different generations of implants.
Okay.
But yes, they are available now.
Okay.
Yeah.
Wow. Very cool.
Yeah.
I like the crops.
If you want, I don't
I'm
know.
gonna get real close to these.
Okay.
Well, we can do charging on Wednesday morning, but if you're off.
Oh, well, no, because
I think we're gonna flip them.
someone will come out.
Oh, okay.
And,
In your
and then I
hands.
just run it.
Say it again.
So
Oh, okay.
Yeah.
it's
So,
good. If you're okay with
yeah.
that.
Yeah, like
Okay.
that. Very good.
It's so fun seeing
And
all
that's the
weekends.
bad one, so go ahead and flip
You
that
love it?
one.
You're so good at it.
Oh, that's very
Yeah.
nice. I don't know about that. I like it.
You've got good energy, and that's what you need in the
Aw,
mornings.
that's
And so, yeah.
Amity
do
makes
the-
it
yeah, keep on
easy.
doing
Of course,
that
this
one.
weekend she wasn't here, so I was like, okay,
Yeah, I was like, I'm sure that.
Exactly. That's what I was.
Hold on a second.
Okay.
Hold on a second.
When I lived in Arizona, breast implants, I was not the norm. Everybody had breast implants.
Yeah.
And we're gonna squeeze both of them.
North Carolina was
And
kind
the
of
other
like
one
that
too at the same time.
And all my friends in the South have had some sort of
Keep on
procedure.
doing that. I'll
Really?
focus on this one over here.
I mean, it makes it easier to talk about and then be like interested. I'm like, oh, so what is that?
Yeah.
What kind of lift is
Yes,
that?
totally.
That's interesting.
Totally. It's fascinating.
I'm like trying to see how much.
Okay, good. Tell me. Don't be shy about it.
Okay,
Michelle and Roman.
so the easiest question is your first and last name, just in
Okay.
case someone else watches this.
Yeah. Should I do it?
Oh, and you can look at me.
Oh, okay. Sorry. Yeah, I have to look at you. Okay. So my name is Suzette Miranda, and I am a plastic surgeon at Swedish Plastics and Aesthetics.
Okay, and spell your name for me.
Suzeette, and my last name is Miranda, which is Miranda.
Okay, how long have you been a plastic surgeon?
So I've been in training for 8 years, but I started practicing a year ago, or this year.
Oh
Yeah.
my gosh, what drew you to it?
So I love the idea that we can give people form and function back. And I think that it's the only specialty within surgery where we can work from the head to the toe. And the idea of breast reconstruction, especially for me, is something that drew me, because when somebody has their breast taken from cancer, I'm able to give that back to someone, which for me spoke more than anything. So
Yeah, sure. Oh my
Yeah.
gosh. And now, like, so many people are very open about it. And
Yeah.
I think the whole, I just think there's a big community where people have a lot of support for women.
yes, definitely, and as we should support each other.
Yeah.
So
Okay, so can you talk to me about this rare breast cancer that is actually, that happens because of breast implants, right?
So on March 21st, the FDA came out with a safety communication, and that was to update what we know about breast implant-associated ALCL. And ALCL is anaplastic large cell lymphoma, and that is a very rare type of lymphoma. But the nice thing is that it's a very treatable type of lymphoma. So what is important to recognize is that it's not a breast cancer. It's not a cancer of the tissue. It's a lymphoma, so a different type.
Okay, and can you kind of even like explain that, like if you were explaining that to like a sixth grader or something? So what is the difference between a lymphoma and a cancer, or
Yes.
what is really happening?
So a lymphoma is a cancer of cells of our immune system, so the cells that fight infection. And a breast cancer is a cancer of the actual tissue of the breast.
Okay, so does that mean that maybe they weren't did they suddenly like get infected and then cancer, or does it mean like maybe someone had their implants in too long?
So there's different theories. So the FDA and the American Society of Plastic Surgery are working towards recognizing a cause. We don't know what the exact cause is, but there could be different theories associated with why some women develop ALCL. One of them could be a genetic predisposition towards ALCL. Another one could be the fact that there would be some bacterial contamination that would then lead you towards ALCL, or that some people react to the texturization process of the implant that then can develop into ALCL.
And what does that mean, the texturization of the implant?
So there's two different types of implants. So there's smooth implants and there's textured implants. And so a textured implant is, why you would get a textured implant is, as some studies have shown, that when placed above the muscle, it decreases capsular contracture rate. So capsular contracture is the scar that can form around a breast implant that can cause pain. And another reason is that because they're textured, they stay in the position that you place them.
Okay, so a lot of people might say, "Oh, this is a good one for me." And they might
Yeah.
it might be more appealing.
And so as a physician and as a plastic surgeon, what you want to do is to inform your patients about the risks and benefits of any procedure. So I offer my patients both, and you have to have a frank discussion as to the risks, the benefits, and why a certain implant would suit somebody and not somebody else. And then together you form a decision, an informed decision on what is best for you.
Do you think that people who have implants should be concerned? I mean, like should they come to the should they call their doctor right away and say, is this something that I should be worried about?
So there is no need for unnecessary panic. The FDA and the American Society of Plastic Surgery have said that if there are no symptoms, there is no treatment that is needed. However, if symptoms arise, then do what you would do and go to your plastic surgeon, see your plastic surgeon, and have a consultation.
Okay. So really, though, when I was reading it, this wasn't like a huge surprise that the FDA came out and said this, because it was kind of been something that people have been monitoring for a while, right?
So it's been the FDA did come out with a communication in 2011. The first case reported was in 1996. So we've known about this, and we're continuing to develop more knowledge and research into trying to discover more about this.
Just curious, have you treated anyone who has this?
No, it's extremely rare. So the good thing is that it happens in 1 in 30,000 women. So the lifetime risk of somebody with a textured implant would be 1 in 30,000. So that is 0.003% of the risk.
Sure.
And breast cancer is 1 in 8 women, so about 12%. So very different, a lot more rare.
Yeah. Oh my gosh, it kind of feels a little bit more settling. But of course, people have died, so you have to take it seriously.
So we do know that deaths have been reported. We do not know much about their other comorbidities that could have also attributed to this. What we do know is that those patients had a delayed diagnosis and or did not receive the treatment that is necessary for this.
Oh, I see. Okay. And then what is the treatment?
Doctor, your hair over.
Oh.
Brush it back there, Doc.
And then, did you say this already? Because sometimes when I go back and listen, I'm like, oh yeah, she already said that. Did you say what the treatment was?
So the treatment is to remove the implant, to remove the capsule around the implant, and to, in rare cases, to have chemo and or radiation.
Okay. Is there anything that I'm missing, do you think?
With the treatment, who's affected, who you call. The really important thing is kind of diffuse the panic.
Mm-hmm.
Yeah.
And I think you covered that.
Yeah. Maybe I should say that, what would women present with?
Oh, okay.
Yeah.
So, like the symptoms that
Yeah.
they have? Okay.
Oh, minor D.
Yeah.
Yeah. Well,
Yeah.
because I read it, so
Yeah,
I knew
yeah,
it, you know.
yeah, yeah.
Okay, so what are some of the symptoms?
So the symptoms, so women usually present with swelling. And so swelling is attributed to a fluid collection around the breast, and that is what we call a seroma. And they can also have pain and swelling associated with that fluid. In rare cases, a mass or a lump could be presented.
Okay. So you would know. I mean, you would, if you had that kind of fluid and you would swell, it would be
So-
pretty obvious.
So women have come in with swelling of that, and then the diagnosis of that is to get an ultrasound guided fine needle aspiration of that fluid, and then send that for specific markers which analyze for ALCL.
Oh wow. Okay. Has there any? Would that be confused with any other symptom? Like, do some women get swelling or a lump?
So you can have a seroma, which is a fluid around the breast implant. Usually those seromas happen within the first year of the breast implant. So a delayed seroma, which is more consistent with ALCL, usually happens a year later.
Okay. And is there a timeline on when people were like reporting like their symptoms? Was it like towards the end of the lifetime of the implant?
So what we know from those cases that have been reported are that women, the time of diagnosis was about 8 to 11 years after an implant was placed, and that the age of those diagnoses was around 53.
Okay, so maybe the implants themselves were a different kind of generation, or a different generation of implants potentially?
So
maybe?
they have been associated with textured implants, but there have been reports of which we don't know much details about with other implants.
So it sounds like still a lot of questions, but in general, no need to panic.
I think that that's the communication and the update that needs to be spread, which is there is no need for panic. If you do not have symptoms, stay the course. See your plastic surgeon as you normally would. And if you do have symptoms, then see your plastic surgeon, and we can help you guide through this process.
Yeah, I just think like how, especially if you had breast cancer, if that was the reason that you have implants, and then you had some sort of lymphoma, some sort of cancer again because of the implants. What bad luck, or
So, but you should feel rest assured that it's very rare and it's extremely treatable. So 90 to 100% once a diagnosis is made in a timely fashion with an appropriate treatment is a good cure rate. So rest assured that this isn't any need for panic.
Perfect. Do you want to say anything else? Did I forget anything?
I'm trying to think.
I mean, we ask you all these questions and we
Yeah.
use like 2 sound bites.
You do? Okay.
Yeah, but I just didn't know if I'm forgetting something.
Let me think.
I can't think. I mean, she hit everything.
Yeah, you covered most everything.
I did.
Uh-huh.
I didn't like my when you asked me if like there's need for panic. I forgot what I said, but I didn't like that.
Okay. Do you want me to
I
ask
don't
you
know what.
again?
Yeah, I should.
Okay.
Okay, let me ask me again. Okay, what was it?
Okay.
What did we say?
Well, I mean, it is alarming to know that some people have died, and it's always alarming when you see something come down, in this news article or whatever, and you're like, oh my gosh, should I panic? But you're saying really no need to panic.
There is no need for unnecessary panic. This is very treatable, and it's so rare that there's no need for any alarms to go off. Patients should be educated and aware, as in most, as in their usual medical.
Sure.
Sorry, guys.
No,
I don't know.
it's okay. I mean,
Sorry, guys. Yeah.
you should know.
Sorry.
You should know
Sorry.
before this.
Okay, I got all like. So yeah. So,
Here.
oh, thank you. Okay.
Oh, Bill Abeda is
Okay.
calling you. Oh, I was like, he's calling me, and then I was like, why would he be calling?
Okay. Sorry. Was that bad? That last one. Okay.
So
Okay.
Okay, so no matter what though, even though some of the numbers can, they can startle people, right? I mean, but there's really still no need to actually panic.
And I don't think that you need to panic. I think that you need to be educated and aware. And as a plastic surgeon, it's our job to educate our patients and go through this process together.
That was great. Thank you. Now I'm wondering, you don't have any like extra